Okay, make sure, again, this is just air, not normal saline. Again, if I have to tell you that, guys, it's happened, right? All right, now, again, Eye of Henley. Our nice little coat hanger here, stylus, stylette. What you're going to do is you're going to insert this down through. You're going to take and bend it. The purpose of this is so that when the provider's going in, it maintains the shape and doesn't collapse. Nothing more difficult than when you're down there, you have the airway open, you go put this tube in, and there's no stylette in here, and it keeps doing this, and you can't get this in through the vocal cords and into the trachea, okay? Most important thing, do you see how this stylus is coming out? We don't want that. Obviously, we're going to puncture things. That provider's not going to be very happy at all. Whenever they puncture something, now we have blood that we have to suction out. We also have some swelling that's going to take place. They're not going to be very happy at all. Again, we just paralyzed this patient. One that could breathe on their own, now they can't. All right, so what you want to do is you want to bring this back. Again, there's our Eye of Henley, right? So bring this just back right where the cuff is, but not as far as the Eye of Henley. You're going to bring it back here. Then you're going to bend this down. That will prevent this from going any further and going down past the Eye of Henley and puncturing the patient or coming out the end of the tube itself. Does that make sense? All right. My suggestion, you get this all prepped, lubricate, keep the package, put this back in the package, take your thumb and your forefinger, and as you slide it in, the Vaseline gauze of whatever you're using for your lubrication, okay? Not Vaseline, but the lubrication you're using, you do this with, and then it smears all that on here, giving some nice lubrication. All right? Now, next thing, and this is what I like to do, but again, everybody does things differently. Get your 10 cc syringe. You're going to attach it to this distal port right here. Throw it on. Again, it's Loraloc. And again, I like to do this when it's in the package. You got to take your syringe and you're going to inflate. You see that cuff there inflated? Once you inflate it, then you deflate it. All right, so they tell you what size. You have this up, ready to go. Now the person says, I want a Mac 3. Okay. Again, Mac's going to be curved. How do you know if it's a Mac 3 or 2 or whatever? If you look at it, it tells you. Mac 1, Mac 2. Some of them have them back here. Okay. So you're going to get the blade ready. Next thing you're going to do is you're going to flip it. There's going to be a light that comes on when you flip it. Shine that light. Make sure you see that it's working and then close it. By closing it, it turns the light off. You don't want to drain the battery. And that's all there is to it. The person's going to come in. They're going to say, hand me the blade. Where's this field blade? Depending on the situation, 9 chances out of 10, the provider is going to have it in the left hand. So it would be good for you to be on the right side. You have your stylus there. You have everything ready to go. They're going to come in. They're going to come down. They're going to visualize. And your job, when you're there, and this person is visualizing everything, they're going to go like this. You need to hand the tube to them. They're going to put the tube down in. pull this out. They're going to say inflate. You're going to put your syringe. You're going to inflate. We're going to take this bad boy. We're going to put it on here.